What up, guys? Good morning. So in this video I'm going to take you through a couple studies that I've found. The first one being titled "Saturated Fat Does Not Clog the Arteries. Coronary heart disease is a chronic inflammatory condition, the risk of which can be effectively reduced from healthy lifestyle interventions." And the other one talks about lipids as well. So if this all sounds interesting, stick through to the end of the video. I think what I'm going to do is I'm actually going to screen record versus just using the snipping tool to take out paragraphs. That way I can show you everything that is in the study, and then I'm also going to link it down below in the description. Here is my Instagram if you want to follow me there. Thank you guys so much for tuning in, and let's jump right into it. Here's an article I want to go over with you guys. It'll be linked down in the description if you want to take a further look into the article information, the citation tools, etc., or the article metrics. Feel free to do so. I'm just going to quickly cover this. I don't want to take up too much of your time. Basically just turn you on to these articles in case you're interested in further research. So the title says, "Saturated fat does not clog the arteries. Coronary heart disease is a chronic inflammatory condition, the risk of which can be effectively reduced from healthy lifestyle interventions." This first paragraph right down here is pretty interesting. If you just follow my mouse, you can see where I'm at. I'll have it on the left side of the page. It essentially says that saturated fat does not directly cause the plaquing of the arteries or clogging of the arteries, and then it goes on to say that there has been no association between saturated fat consumption and all-cause mortality, coronary heart disease or CHD, CHD mortality, stroke, type 2 diabetes. It says there's no benefit from reduced fat, including saturated fat, on heart attacks or all-cause mortality. And it also said that there was a study of postmenopausal women with coronary heart disease, and there was a greater intake of saturated fat was associated with less progression of atherosclerosis or plaquing of the arteries, whereas carbohydrate and vegetable oil intake were associated with greater progression. They call it polyunsaturated fat. Next paragraph essentially says that the issue is not as much atherosclerosis as it is atherothrombosis. That's when the plaquing of the arteries actually pops and it clogs the pipes. And so you can think of it as like a pimple popping. So it's like, over here where my mouse is, if you see that plaquing up in here, that could essentially be thought of as a pimple, and when it pops, all that gunk is now in your bloodstream. And so what happens is, a heart attack can occur within minutes. And so this is pretty much like clogging of the pipes when, when these accumulations of cholesterol pop. And what they're doing is they're trying to, mitigate, and it's kind of like a Band-Aid for the inflammation. And so they're essentially saying that the main issue is inflammation, which leads to the plaquing of the arteries. They're trying to kind of like soothe and mitigate damage and Band-Aid the issues. I would take this diagram with a grain of salt, but let's see what they have to say. Excess fructose refined carbohydrates lead to type 2 diabetes. It also says that too much omega-6 or too little omega-3s or too much refined carbohydrates lead to systemic inflammation and or insulin resistance or type 2 diabetes, which therefore which then goes on to lead to these heart attacks from atherothrombosis. What do I think of this? So yeah, these things could definitely be issues. It says a high-fat Mediterranean diet could prevent this with lots of oily fish, olive oil, and nuts. I'm not so sure about that type of stuff, but yeah, and not like insulin resistance. So you're going to have an inability to process carbohydrates as a fuel, but generally what I see too is that there's a higher level of triglycerides, which is an inability to process fat is fuel as well. So just an inability to utilize and process fuel from food, therefore it floats around in our bloodstream and it leads to high levels of inflammation. So down here basically says that people are doing better on a higher fat diet. LDL cholesterol risk has been exaggerated. Here we are. Essentially says that it's more important to look at the ratio between total cholesterol and HDL, and that LDL is not as much of a factor. What else do we say? It says replacing saturated fat with linoleic acid containing vegetable oils increased mortality risk despite significant reductions in LDL and total cholesterol. So it says even though they were able to manipulate people's LDL cholesterol by bringing it down, it didn't necessarily decrease their risk of mortality. All right, and the last paragraph, or the last couple paragraphs, talks about a simple way to combat insulin resistance, and this is going to be regular exercise. They talk about brisk walking, 30 minutes 3 times a week can significantly increase lifespan by 3.4 to 4.5 years. And then this is a big one that I don't hear as many people talking about. Like if you look at this very last paragraph, it says another risk factor for coronary heart disease is environmental stress. Childhood trauma can lead to an average decrease in life expectancy of 20 years. I honestly believe that, it really just depends. Like if your diet consists of like Cheetos and candy bars, I think that would probably take precedence over environmental stress or like just the daily stressors of life. But I think in general, if somebody's like conscious about what they're eating, that environmental stress is probably going to be like the biggest factor when it comes to longevity and just living like a happy, healthy existence. So, definitely prioritize, the way you're living your life. Make sure that you're not, working a high stress job that you hate, and that you're in like relationships that you don't want to be in, and that, basically take responsibility for how you feel in your day-to-day life, and do what you can to make changes, and make sure that you're reducing stress. You're taking action to really just take care of yourself on a daily basis. Maybe it might be just going and getting a massage, going to yoga on a regular basis, getting out of unhealthy relationships, whatever it may be. I'm sure that if you bring some awareness to it or pay attention to it, you can figure it out pretty easy what it is. So let's go over to a different study. I haven't even really read through this one too much, but here we are. It says lipid levels are inversely associated with infectious and all-cause mortality. This one's just really short, so I'll just read through it. Cardiovascular events are increased 36-fold in patients with end-stage renal disease, so that's kidney failure. However, randomized control trials to lower LDL cholesterol and serum total cholesterol have not shown significant mortality improvements. An inverse association of total cholesterol and LDL with all-cause and cardiovascular mortality have been observed in patients on chronic dialysis. It says lipoproteins may also protect against infectious disease. So lipoproteins meaning LDL particles. They use data from 37,250 patients. So what it's saying is that when patients lowered their LDL, their total cholesterol and LDL cholesterol, they didn't really show an improvement with all-cause and cardiovascular mortality. And then it also goes on to say that lipoproteins may have some sort of immunological benefit. So they're tied in with the immune system somehow. So this is just really short. There's not much more to it. Thank you guys so much for tuning in. Give this video a thumbs up. Subscribe for more content and stay tuned till next time, guys. Thank you so much.